Hi everyone, it's Jessie Mundell from JMG Fitness, and we are here with Sami Cattach from Body and Birth Physiotherapy in Brisbane, Australia. So thank you so much, Sami, for being on the call today. I'm so excited to pick your brain and talk to you about all this pelvic floor and core stuff.
Awesome.
So first things first, can you just tell the listeners a little bit more about what you do as a pelvic floor physical therapist and as a restorative exercise specialist?
I initially did my study and my training as a physiotherapist and subsequently found a love or a passion, I guess, for pelvic floor physiotherapy. And it's such a huge component of so many women's lives, and especially pregnancies, as to how well those muscles function, how they cope with pregnancy and then delivery and beyond, of course. Yes. As I then did my restorative exercise specialist training, it just brought a new perspective on top of that pelvic floor aspect as well. So stepping back from looking just at the pelvic floor muscles and how they function as a unit, but how they function as part of the whole system that is your entire body as well. So we know now that it is just one piece of the puzzle, and you can't have a strong pelvic floor without a strong butt, a strong core, sure, and a well-functioning system all over. Yeah.
Cool. So it's not just, we're just focusing on the abdominals or the pelvic floor muscles. It's really, we have to look at the whole body and how it functions together.
Yeah.
Okay.
And not just how you exercise, but I like to look at how people stand, how they sit, how they move throughout the day, which will have just as much effect on the function of those really key muscles as well.
That's a really great point. I think that is probably such a key missing piece of the puzzle. We just think about the exercise time that we're doing, but really that time is so short compared to everything else that's happening during our day.
Yeah.
Okay.
Absolutely.
So here's what we should start with. What is the pelvic floor? Because some people don't even know what that means, or if they're muscles, where it is in their body, how they can find it. So what is the pelvic floor and why should we be paying attention to it?
So I brought my model.
Oh, good.
This is she's Patty the pelvis because we're in Paddington. This is Southern Darwin. But your pelvic floor muscles literally form the floor or the base of your pelvis. So we don't have any bony structures down here. So these muscles are kind of the last port of call, I guess, between the inside of your body and the outside world. And they are designed to help control your bladder and bowel. So the most common thing that people think of when they think of pelvic floor issues is usually incontinence, because it is a very common issue. 1 in 3 women postpartum report some kind of stress incontinence, which is the leaking from the bladder. It also helps to control bowel movements, provides sensation during sex, allows for intercourse. Sometimes if the muscles aren't functioning well, it can be very uncomfortable or painful. They also help to support and control the mobility of the pelvis too. So your sacroiliac joints back here will be stabilized by your pelvic floor muscles in conjunction with all the surrounding musculature as well.
Cool.
So one perspective that comes more from the restorative exercise as I furthered my training beyond just the pelvic floor physio is how these muscles do work, again, more as that just one piece of that puzzle. So we know that Kegels or pelvic floor exercises are often recommended for strengthening the pelvic floor muscles, but whenever you are upright and standing, or just upright, your pelvic floor muscles are underneath the weight or the load of your pelvic organs, the weight of your baby when you're pregnant, and then everything else above that. So in response to that load, your pelvic floor muscles are gently working out all the time. So if you are moving your body well all the time, you shouldn't have to do specific Kegel exercises to strengthen them, but it can be a very helpful skill to know how to do if it's some specific issues.
Yeah, great. That's a really good point. I think that's probably the number one question that I get asked from women is, should I be doing my Kegels? How do I know if I'm doing them right? And really the question is more so, should you even do them at all? Is that going to be effective for your body? So when would you recommend Kegels to someone?
Generally, only after I've done an internal exam to make sure that they are doing it correctly, because just having a verbal or a written description sometimes isn't enough. And a percentage of women will actually be causing more harm when they try to do them by generating more force or pressure downwards instead of gently contracting just the pelvic floor muscles. So if I have a patient who doesn't have a lot of tension, because that's the flip side of the strength coin, I guess, but if they have weakness and they don't know how to engage their pelvic floor, then we'll go through some specific exercises to teach them how to connect with their pelvic floor muscles. The other time that it can be quite nice, though, is within 24 hours of delivery, just really, really gentle pelvic floor contractions, especially if you're not up and moving just yet, to help with the circulation and the healing.
Okay, excellent. That's great to know. So most of the time then, what do women come to see you for in terms of your specific in-person services?
So the most common things would be for diastasis recti, so abdominal separation, which is, less pelvic floor, but of course it's all part of the same system. And prolapse is a very, very common concern as well. But more and more lately, I've been getting women who, wanting to be proactive, want to learn about their bodies during their pregnancies, even though they don't have any issues yet, to prevent issues later on.
That's great news.
It's amazing, yeah.
Nice. Okay, perfect. So I love that you mentioned the word prolapse, and maybe we can get into that a little bit more. So can you just tell us what pelvic organ prolapse is?
So prolapse is the movement downwards or the descent of your pelvic organs. So your pelvic organs being your bladder, your bowel, and your uterus. And if they are subjected to excessive force internally, over time, the ligaments supporting them and holding them up will actually lengthen. And if the pelvic floor muscles aren't providing support from underneath, then they're going to start to move downwards and bulge into the vagina, or sometimes even outside of the body as well. So it's not usually just a one-off event that does cause a prolapse, but birth, for example, can be kind of the final straw, because it is quite a significant physical event that creates a lot of pressure. But it is more of a symptom rather than the actual issue. So it's a symptom of repetitive pressures inside the abdomen.
Perfect. All right. And so what is the percentage then of women who have had a pregnancy and have given birth, whether it was vaginal or a cesarean section? What is the percentage of women that will have some degree of prolapse?
Hard to say. I probably see, out of the women that come to see me, and I probably have a bit of a skewed perspective because most women come with concerns, but almost 50% would have some degree of prolapse afterwards. But that's not including the women who feel great after and don't come to see me.
Yes, for sure. Yeah, not to scare anyone at all, but those are the stats that I have heard as well, that it's about 50% of women that have had a baby will have some degree of prolapse. But I think it's also important, and you can tell us a little bit more, that the grade of prolapse it can be so varying, correct?
Absolutely. So it's usually classified in a grading system of 0 to 4. So 0 is absolutely nothing. 4 would be where the organs are almost completely outside of the body, and that is quite rare. The majority that I see would be a grade 1 or 2, And that's where the organs are starting to move downwards, or they're bulging into the vagina, but they're not coming outside of the body. And up to that grade, generally speaking, although I have had some women with grade 3s do this as well, it can be conservatively managed to actually reduce that prolapse without any surgery.
Fantastic. So that's why it's so important if women do see you in pregnancy and early postpartum, even if they're not experiencing symptoms, correct? Because they could potentially have some slight degree, and if you catch it then, so much easier to manage and heal.
Yeah, absolutely.
Okay, excellent. So that is great. All right, so we have tons of questions to get to that my clients into Pregnancy and Beyond sent in, and they're really smart. They know their stuff. Yeah. So we'll see what we get to, and couple more questions about prolapse, because some of the girls in my coaching program are pregnant with prolapse, strength training with prolapse. So we talk a lot about it, just so how we can manage, not increase their symptoms. So a couple of different things to ask you. So first question, how long after resolution of a cystocele, and you can explain that word if you want to, through physio would you recommend a subsequent pregnancy?
So a cystocele is a prolapse of the bladder, or the anterior wall that's starting to fall down and bulge into the vagina. And that is the most common one that I see. If you have been able to resolve it, fantastic. That is so amazing, because it takes a lot of work and commitment to your exercises and your program. So congrats on that. After resolving it, I would probably give your body between 6 to 12 months. It depends on how long since the last pregnancy too, because those hormonal changes that occur during pregnancy do take up to 12 months to totally even back out again.
And those hormonal changes can also be affected by breastfeeding? Yeah, so that's true. If you are breastfeeding, it could take a bit longer for your connective tissues to kind of return back to normal laxity, or...
Yeah, exactly. So a lot of women do see noticeable improvements once they stop breastfeeding, or have some improvements in their symptoms just from that, even without changing too much. But if you can continue doing, so whatever you've done to resolve that prolapse for this particular question, continue doing those things throughout the period while you're trying, and then while you're pregnant, right up until next baby and beyond, as long as it's safe to do so while you're pregnant. Okay, excellent. And so in the case of having prolapse during pregnancy, what can you do to not increase that from worsening during pregnancy? So there are, I guess, a few habits that a lot of us have that do contribute to prolapse. So whether you're pregnant or not, it's kind of the same thing that you want to be doing. But decreasing any excessive intra-abdominal pressure. So that's things like holding your breath with any movement, or straining, whether it's to lift something up or when you go into the toilet, because constipation is more common during pregnancy often. Specific exercises that do generate a lot of internal force or pressure, so like crunches, sit-ups, that kind of thing, may not be the best choice at that time. Absolutely. Okay, so this question we already kind of touched on, but I like it a lot, and it's basically, do prolapses ever heal without surgery? Yes, absolutely. Yes. Excellent. And I think this is one that a lot of women come to me with anxiety about, because I think in a lot of cases they've been told it's not going to. It's same with diastasis recti. They've been told that basically the only option is surgery at the point they're at, when they haven't been to pelvic floor physical therapy yet or tried a rehabilitative exercise program. So that's extremely good news. And what sort of things would you do with them in the case of prolapse to help manage or heal? So restoring those pelvic floor and core functions, so starting with alignment, how you stand is really, really huge. doing a strengthening program. And this is why I love your program so much, Jessie, because it does focus a lot on all of the musculature that support the pelvic floor muscles as well. So a lot of glute strength, and then guided core exercises too is really good. And then being mindful of those things. So you could be working on your exercises, but if you are still generating those forces by straining with different activities, or even, and this is one that I've been working on for myself, if you have a habit of sucking in your stomach or holding a lot of tension in your stomach all the time, you are constantly generating a lot of intra-abdominal pressure that isn't necessary.
Yeah.
So
that's a big
you have to work on the things that you can, but also stop doing the things that are potentially contributing to it still.
For sure. That's a really good point. It's that, it's those things in your daily life that you might not notice you're doing them, but then once you gain the awareness of it, it's almost like it doesn't leave your brain and you're kind of constantly thinking about it for a while. Feels tricky at first, but then becomes part of your normal routine, and you catch yourself when you're in that slumped posture and tucking your bum under and doing that kind of stuff.
Absolutely.
Okay. So this is an interesting one. So someone that has prolapse from first pregnancy birth, it was a symptom afterwards. Pregnant again, is it going to be possible to heal that prolapse after the end of this pregnancy, another labor, another birth?
Yeah, absolutely. Again, continue doing all those things that we've talked about. But during birth, and I know this was another question from the gals too, was how do I prevent excessive strain or too much damage to the pelvic floor during delivery itself? So there's a couple of key things that I would avoid, which is holding your breath and pushing. And that has been taught in hospitals for a long time, but it is a bit more of an outdated practice. And it does create a huge amount of intra-abdominal pressure and force on not just your baby to help them move downwards, but onto everything inside your abdominal container and your pelvic container.
Right.
So make sure you don't hold your breath.
Keep breathing.
And then avoiding, I guess, heading back into any activities postpartum that would be a little bit too intense to start with.
And so just building on that a little bit, once you are early postpartum, how long do you recommend that your patients really stay off their feet for?
Not necessarily stay off, like not total bed rest. But I would even encourage just moving. So do a lap of your room, do a lap of the house as soon as you feel that you can, and slowly increase that every day. So your pelvic floor muscles are stimulated, they're working, they're training when you are moving. So if you're lying down, doing those gentle pelvic floor exercises are fantastic. But if you're feeling up to it, just start with whatever you can to get moving, and then gradually build from there.
Okay, perfect. That's great. All right, excellent. So this next question, this is excellent, actually. This is one that a couple people were wondering. Are there any positions to avoid during sex if you have a prolapse?
So with a prolapse, so the organs are moving down, generally, again, any positions that might be causing you a lot of strain or generating that intra-abdominal pressure would be things that you want to avoid. Intercourse itself, though, generally won't cause any harm to a prolapse or make it worse unless you're bearing down, holding your breath, that kind of thing. But most women that I've worked with do find it more comfortable first thing in the morning to have sex, because after you've been lying down for a while, the prolapse is somewhat reduced. It's not sitting as low as it might be at the end of the day.
Okay, excellent. And I think I've also heard a couple of physios say that intercourse can actually be beneficial for even short term for prolapse because it can kind of get things back in the right position.
Yeah. Yeah.
A physio was telling me she had a client who loved to run, prolapse, didn't want to give up the running, so she would have sex before she went running to kind of get things up, and then she would go on a run. I love that. Okay, so we'll move on a little bit from the prolapse, but more so getting into kind of incontinence and what that all means. So what is stress urinary incontinence?
So stress incontinence is where a physical stress or pressure is applied to the bladder that forces the urine down, and that stress is greater than the resistance or the closure that your muscles can provide to stop anything from exiting. So again, intra-abdominal pressure tends to be a big one. When you cough, when you sneeze, creates that pressure inside your abdomen. If your pelvic floor muscles can't react strongly enough or quickly enough, so they might have the strength but not the coordination to get there that quickly, then that's when urine can escape. Okay,
excellent. And I guess we've talked about this before, but the difference between strength and weakness and how it's more function.
Yeah, absolutely. So I have had women with what we would grade as a 5 out of 5 pelvic floor strength, but still have things like incontinence or prolapse. So your pelvic floor muscles can be strong, but if they are not engaging at the right time or don't have the appropriate leverage to be able to do that, they won't be able to provide the support required, I guess. So most of the people that I see have muscles that are too tight rather than too weak. And sometimes when they are tight, they can still generate that force, but it's not very effective or efficient.
Excellent. Yeah. And just a personal example from my own experience postpartum was when I saw Gail at Lakeview Physio in Calgary here, and that's who I recommend everyone in Calgary sees, and that's where Sami used to work, and it's a fantastic clinic. So I saw Gail for 3 sessions. First session was at 5 weeks postpartum when we did an internal pelvic floor assessment, and for me, I knew that probably for years now, competitive gymnastics, tons of impact exercise, crunches, leg raises for years and years, but I was holding more tension in the pelvic floor, so there were areas of tightness, and my strength, therefore, wasn't as strong as it could be in the pelvic floor. So for me, and for lots of women, I'm sure that you see as well, you have to release before you can actually allow those muscles to be stronger, right?
Yeah, absolutely. So if you can imagine that my bicep is my pelvic floor, if your pelvic floor bicep is already contracted and then you sneeze, you can't generate nearly as much force here as if you are already in a mostly relaxed state or completely relaxed state. You can create that sufficient amount of pressure to stop that leaking, I guess.
Awesome. Good. I love that example. That's great. Okay, so this woman would like some information on stress incontinence between ovulation and her period. So it's the only time of the month that she has this issue with sneezing or coughing. Is it hormone related? Is there anything that she can do to help prevent this or stop this?
Yeah, so I have had quite a few women who definitely notice an increase in their pelvic floor symptoms leading up to their period. So I do think there is a hormonal link that affects maybe the consistency of the tissues or the laxity of some of the supporting structures as well. So it's great that it's not happening all the time for her, but it might be that just that little bit more laxity is just enough to bring her symptoms on. Even so, I would still recommend all of the things that you would do anyway to regain a strong and functional pelvic floor. So your alignment, your strengthening, your releasing of any tight muscles as well, and she should see an improvement still with that.
Excellent. And I've also a few women have talked to me about that increase of prolapse symptoms as well around that time of the month. So, and you see that as well in your clients?
Yeah.
Okay. So just keep doing what they're doing as best they can to support it.
Mm-hmm. Mm-hmm. Maybe, and especially if you're aware that things do feel a bit worse for you in that particular time, being much more mindful of how you're moving in those days. Yeah.
For sure. Potentially lay off the loaded strength training. Yeah.
Yeah. Just back off a little bit even.
Yeah. Okay. That's good. That's great advice. Okay. Next one. I read somewhere about overcompensating by tightening the inner thigh muscles. I wonder if I do this because I can't seem to relax them when I'm engaging my pelvic floor. What say you?
Yeah. So a lot of women do have different compensation actions that they do when they're trying just to engage their pelvic floor. Mm-hmm. So contracting the inner thighs is definitely one of them. Mm-hmm. Squeezing the glutes, contracting the abdomen, or holding their breath. They're all those compensatory mechanisms, I guess. Ideally, when you're trying to do just an isolated pelvic floor exercise, you shouldn't need to recruit any of those other ones. And especially if you're lying down, those muscles should be pretty well relaxed. And it's much easier then to do that isolated pelvic floor exercise. Mm-hmm. But when you are up, standing or sitting or moving, all of those muscles are working anyway. And in real life, your pelvic floor never works in isolation anyway.
Right.
So it is good to gain that kind of connection with your pelvic floor, brain muscle connection.
Yeah.
So lying down might be a good place to practice for her.
Okay.
So you should be able to do it, but otherwise don't worry too much.
Okay, perfect. Excellent. All right. We kind of already talked about big tips. We should do it again, though. Big tips or big takeaways to remember during labor and the very early postpartum time to prevent or lessen prolapse or just weaken floor issues like stress incontinence.
Yeah. So the breath holding really is one of the biggest things. So often we call it purple pushing, because if you're holding your breath, you go purple in the face while you're creating that much pressure. So that's a really, really big one. And also, we mentioned just before, when you are loading your pelvic floor muscles, they are contracting. So if you are loading them with that pressure, you're creating more resistance in the muscles even to then force your baby to come out of. Mm-hmm. So exhaling during a push, or just making sure that you're continuing to breathe rather than holding would be really, really key. Leading up to delivery, doing as much as you can to prepare the pelvis and the pelvic floor muscles. So I do a lot of stretching for my mamas, a lot of unloaded squat prep if they're not comfortable doing some loaded ones, to release any unnecessary tension in the muscles, again, just so that they don't have to generate as much force, they don't have to push as hard during delivery. And then postpartum, we talked about the gentle pelvic floor contractions and gentle movement once you're ready to do so. And sleep is huge.
Rest.
Sleep when the baby does as much as you can.
So true. Mm-hmm. And then any other specific positions for mom to be in while she's laboring that could be effective?
Mm-hmm. So if there is already some prolapse, or if you are just wanting to decrease the strain, I think your body really will tell you what position is best for you. Mm-hmm. So there's no, definitely be here, but to decrease that load, you may want to try like a sideline position. Can be quite nice. So kind of inclined sideline. Or if you are on your hands and knees, or like leaning onto the table or onto a bowl, so that you're not totally upright where above might come quite quick, or where there's a lot of downward force, but more of a gradual slope, I guess.
Cool. Yeah, and I think I was telling you that was what I found most comfortable in labor. I spent a couple days pretty much leaning forward slightly. But that, and my midwives and doula were trying to get me in other positions at times. Mm-hmm. And it was just unbelievable how uncomfortable it felt trying to move into them. So I think really just like trusting your own instincts about what is working for you. And if it's not working for you, just tell your healthcare professionals, whoever you're with in that situation, that it's not comfortable. If they're trying to get you to be flat on your back or that semi-reclined position on your back and that's not feeling good, you can encourage them to let you try other things.
So with the lying flat on your back, and because gravity is not helping you, generally you will have to push more, generate that force. So that's why we tend not to be on your back. And also because it doesn't allow your sacrum and your tailbone to move and get out of the way to create more space for your baby.
Right. So it's almost more difficult for you on your body to be in that semi-reclined position.
Yeah.
Okay. So that is all excellent advice. So I'm excited to get your take on abdominal wrapping because I don't think we've talked about it before, and I know it's a bit of a controversial subject in the physio industry and in my industry with postnatal fitness. So do you ever recommend some compression on the abdomen or abdominal wraps that women could use?
I tend not to. Usually when I see women, it's 5 or 6 weeks postpartum. In the hospitals, though, if the woman does have, 6 finger separation or more, then they'll often provide some tubie grip or just like probably the equivalent of a light wrap, just to give her a little bit more support in those first few days or first week can be really, really helpful. So have you seen the different wraps that people use, or not? Because I know binding and splinting and wrapping, people tend to classify them differently.
Yes. So different ones that I'm aware of. The one I used was actually, I did the compression shorts, the SRC compression shorts, which they're based in Australia, actually. And I really, really liked them. It just felt like I wasn't a sausage in a casing in them. I didn't feel like it was so tight that I couldn't breathe or couldn't move. I actually just felt like it was just nicely supportive on my pelvis, my low back, my belly. I did wear an abdominal wrap, kind of with like 2 arms. I tried one of those for a few days as well. And I had to be very aware that I wasn't wrapping too tightly and creating downward pressure or too much like belly button to spine kind of movement. So, but I did enjoy the support of that as well on a few occasions where I was wearing it. Some women, actually a lot of women have asked me about the rebozo style wraps with the, I think it's more so used in African cultures. I've seen a lot of photos of it then, where it's these like tons of pieces of fabric. It's so beautiful. It's like tied almost down the middle of the belly. But I don't know anyone that has used one of those before.
And I'm not familiar with them either. I think the main things to keep in mind if you are wanting to do any wrapping is that you don't want to become dependent on it, because it will inhibit your own pelvic floor core muscles from doing what they're supposed to do.
For sure.
But if you're going to be on your feet for a long day, for example, and it helps you to feel better, it might be just perfect for that day.
For sure.
And how long did you wear your shorts for, Jessie?
I started wearing them at 2 weeks postpartum. I tried prior to, and it was just, I couldn't handle the sensation on my C-section incision. So I wore them 2 weeks postpartum until about 8-9 weeks postpartum, but 2 to 8 weeks pretty consistently most days for maybe like 6-8 hours out of a day I would have them on. So, and during that time as well, it's like you were saying, I was doing my core and pelvic floor restoration exercises, paying attention to my alignment in every situation that I could. So it's exactly that. It's abdominal wrapping or compression is not just a fix me strategy. It can be a tool, but it's not the whole story, right?
Yeah, exactly.
Excellent. Okay, cool. So, and I like that you were saying that about you see women at 5 or 6 weeks postpartum. So it's not often a strategy you would use then in a lot of people. And I think a lot of the research says that first 8 weeks postpartum is where it can be beneficial. So if someone was going to use some compression or wrapping earlier in postpartum, the better.
Yeah. And trying to wean off it as ready as whenever you're ready, I guess. Yeah.
Excellent. Okay, good. So, and this is interesting. If someone does have a prolapse, would you recommend that they don't do abdominal wrapping, or is it still okay then?
If you are narrowing the circumference of your waist with that wrap, then you are creating some pressure. So even if you squeeze your belly this way, that's going to force things in either direction. So depends how much compression that wrap is, I guess.
Right.
Yeah.
So it's kind of, and I think personally what I found is that I would notice immediately when I had the shorts or the wrap on if things did feel like they were heavy or if I couldn't breathe well. So I think it's one of those things where you really have to catch yourself. Don't think that you're wearing the abdominal wrap to get your abs back or to heal your diastasis recti. And really, be honest with yourself if you feel like it is causing any issues or discomfort.
Any heaviness, pressure, things aren't feeling quite right in the pelvic.
Okay, cool. So this next question, when do you know that a client is ready or safe to start more high impact activities like running postpartum?
So because I am a physio and I can do that internal assessment, I do check that they have full control of their pelvic floor muscles. So I'm looking for a very controlled, smooth contraction, and ideally that 5 out of 5 strength, but also a very smooth and complete relaxation component. So not just the contraction, but also that full release. If they are not having any other symptoms of heaviness, pressure, pain, leaking, and then if we can, depending on what the exercises are, I'll watch them jog, or I'll watch them run, or I'll watch them do some of the plyometric exercises that they want to get back into, and make sure that they're not needing to hold their breath or strain during any of them.
Perfect. And do you have a guideline for postpartum that you definitely recommend that they don't do any running or high impact exercise?
I would give your body, considering the amazing feat that it's just performed during delivery, I would give it at least 3 months at the minimum. And while doing all of your pelvic floor and your core restoration programs, but even then, just starting back by a light jog, so 5 minutes, and then gradually increase that by 5 minutes or increase the speed a little bit every week or every few days or something like that.
For sure.
So there's really no set guidelines, I guess, but what I would ensure is, pelvic floor and core programs and a really strong butt before you get into running or, more intense stuff.
And honestly, what I found is just there's so much other stuff to do in terms of the rehab and the exercise that there's no time to do that running as well, because you have to build up this base again to be able to get back into those more fun exercises, but you have to do the work first. I really think that you almost have to earn your way back to that high impact exercise. Or even exercises that are not high impact but are very physically demanding or challenging.
Absolutely.
Okay, next one. Tips or pointers for a technique with coughing, sneezing to prevent the pelvic floor from feeling like it bows down like a trampoline during that coughing, sneezing. So this is a good one with cold season right now here in Canada.
Yeah, absolutely. So when you cough or sneeze, ideally your pelvic floor should reflexively contract to stop that downward force, I guess. So if you're finding that if you do experience that bowing or that downward movement, then preparing yourself by doing a pelvic floor contraction can be quite helpful. However, when you are coughing or sneezing, your pelvic floor, your diaphragm, your abdominal core muscles are contracting to expel air up and out. So again, ideally, there shouldn't be any force going downwards. It should be going the other way. And if it is going down, that might be a sign that your diaphragm has actually almost reversed the direction that it's contracting in during that cough or sneeze. So one of the biggest things that you can do to practice there is, again, all of your pelvic floor and your core restoration stuff, but diaphragmatic breathing too. So that's breathing with that focus on moving your rib cage, expanding out into the rib cage, so out to each side and also front and back, as opposed to breathing into your belly or your chest.
Right. Okay, perfect. Yeah, super important. And that's what I tend to see a lot of women. It's breathing all up here and getting them to start thinking about that rib cage expansion is really tricky at first.
Yeah. But once you get it, it becomes much more natural, much more of a habit.
Exactly. Practice. So this question was not on the list that I sent you. Someone just submitted this one. But it's those jade eggs, or using things to insert in the vagina to practice or to strengthen your pelvic floor. What do you think about those?
So your pelvic floor is designed to respond to the loads that are placed on it. And you can have those muscles working whenever you're moving, like we said. But when you start adding more load, then to me that's encouraging an increase in more tension, I guess, because it is possible to have too much strength. So your pelvic floor doesn't need to be working 150% all the time. It just needs to be working exactly as much as it needs to, depending on what you're doing.
Cool.
So there's no need for extra weights to train the pelvic floor muscles if you're doing all of the other things. Yeah.
Excellent. That's a really good explanation. Very good. Okay, so just a couple more and then we'll wrap up. But what are your thoughts on running during pregnancy? Do you, for your clients and your patients that really love to run, do you recommend that they wean off at a certain point, or do they run all the way through? What are your thoughts on that?
Yeah, it totally depends on the individual and how they're feeling. So if you have been a long-time runner, your technique is good, you don't have any knee, hip, or back pain from running, because that is an indication that potentially, again, your support structures, your glutes and your core aren't working to the extent that they need to be during your running. Then during your first trimester, totally fine. As you start to show, I might start to wean back more during the third trimester, if not a little bit sooner. Because your ligaments, even though you may have the strength and the technique of running, your ligaments are much more mobile. They're more lax because of the hormones in your body as well.
For sure. And that's the biggest concern, right? It's not about mom's health or baby's health. It's more so about, those pelvic floor and core structures.
Yeah. And ligaments, unlike muscle, if you stretch them or strain them, they don't heal as well or come back necessarily as well. So once you've stretched them past a certain point, it's really hard to get things back.
Yeah, so preventing extra issues best in pregnancy.
Mm-hmm.
Okay, so this one, I love this one. I think this is how you operate, but she says, my physiotherapist does manual internal assessment, has no fancy equipment to check what else is going on inside, like ultrasound. Is that sufficient?
Yeah, I believe so. So if your physiotherapist is well trained and experienced, they will be able to tell just from palpation, so what they feel with their fingers, as to what your muscle tone is like. So is there too much tone? Is there not enough tone? And how well you can engage your muscles and release them. The other thing that using just that manual palpation can do, as opposed to using a machine, is I can tell which muscles are switching on, and is one before the other, or are the different sections of your pelvic floor working in coordination with each other or not. So I don't think it's necessary to use a machine. Sometimes it can be helpful, and some women really find that having that visual kind of graph of watching the electrical activity in the pelvic floor increase as they contract and then go back. As they go back down, a helpful training tool. But because you can't really take it home, I find it doesn't really carry over to practicing very well.
Makes sense. Okay, cool. Is there anything else that you really want women to know? Anything else we didn't talk about or I forgot to ask?
Whew, that's a big one. We covered a lot of stuff, and I'm really, really excited to have had the opportunity to share a lot of that good information. Walking is king. Your
perfect.
Every single muscle in your body is being used when you walk, and especially if you can walk the right way, which is using that gluteal, so the pushback motion from your leg, as opposed to just reaching out with the front leg. And this could be a whole nother hour kind of discussion.
Yeah.
But with every step, you're using your glutes, you're using your hamstrings, you're creating that leverage for your pelvic floor. So you're strengthening everything and your core with every step. So, yeah, walking is, when it's not minus 30.
Yes, exactly. Or plus 30 for you right now.
Yeah.
Okay, Sami, thank you so much. That was incredible. Such good information that I know will help so many women. So just to wrap up, where can we find more information about where you are, what you do, and what your work is?
Sure. So my website is bodyandbirthphysio.com, and that has a whole lot of information about me. It has my blog as well, which details a lot of different pelvic floor conditions and techniques to start improving some of that pelvic floor function and the core function as well. And I do practice locally in Brisbane. I teach some classes, but I also do online consultations and Skype consults as well for women living in rural areas or overseas.
Perfect. That's actually excellent, because a lot of women do come to me and there's no one around them, but they want to see someone or at least talk through things that are happening. So that is great to know. Okay, well, thank you so much, Sami, and we will chat with you soon, I'm sure, again, about a whole bunch of other core and floor stuff.
Sounds good. Thanks so much, Jessie.
Okay, thank you.